Let's bring him in. My good friend, Dr. Joe. Dr. Joe Kindrini, Sports Medicine Center at Akron Children's Hospital. Good morning, my friend. What do you have for us today?
Hey, Ray. How you doing today? I wanted to talk about one of our real common injuries in a pediatric sports medicine clinic, what makes us different. And I'm going to kind of go back a ways and look at this over time. At being here at Akron Children's for over 30 years and seeing injuries to young throwers, I was much more optimistic early in my career that this was going to be something we were going to be able to prevent, maybe even get to the point where we could, avoid having these injuries at all. But I have to say I'm disappointed in about 30-plus years now of seeing that this is an injury I don't know that we've done all that good with. And kind of go over some of the things we try to do to prevent these throwers' injuries. So this is a classic injury, Ray, of overuse, of doing too much, overuse, overload, overstress injuries that occur to young pitchers, typically in the age range of about age 8 to about 15 or 16 years of age. And typically, that's the period of time where the growth plates are open in the shoulder and the elbow, and both of those can be injured. And so we started putting together prevention programs several years ago. One of the issues was to be careful of starting so young, and so that a lot of people start at age 8 or 9 at pitching a fair bit. And that's pretty young to be starting to grow. The body really hasn't matured a lot yet. There isn't enough strength in the hips and the shoulder girdle to really be able to take some of the pressure off the shoulder and elbow. And that's part of why the injuries occur. So that was one of our recommendations. Another recommendation was, of course, we would talk a lot about pitch counts. But pitch counts not only per game, but also per month, per season of the year, and per year overall. And so trying to reduce the amount of pitch counts, maximum effort throws that young throwers have to do. And so number 2 would be pitch counts. Number 3, we talked a lot about teaching young throwers up to about age 14 to command the strike zone more rather than just rear back and throw with velocity. And unfortunately, the prevailing wisdom has been the pitchers who make it further are people who they pick you up on the radar gun and velocity. And so all the talk in the last 5 and 10 years, much of it has been much more about velocity versus command of the strike zone, which was our recommendation. A fourth phenomenon that we'd see a lot in young pitchers that we'd warn them about in our office, again, we get them, though, after they're injured. We need to get them before they're injured and have these prevention programs. And so a fourth part of prevention program is the too many teams. Is a lot of times when you have a good pitcher, you know how it is. And as we get into the spring of the year like this and then into the summer and then even into fall ball, good pitchers will be asked to be on a team, be on a second team. I have many kids still today in my office that are on 3 teams in a year, and that is clearly too much, and that really leads to some of the injuries to these growth plates. Number 5, is taking one season of the year off. So either, if you're going to play in spring and summer, either fall or winter, totally off. 3 months, I really would prefer 4 months. However, those are the times when a lot of kids are playing fall ball or they're in winter instruction where they're pitching inside in the winter, trying to work on their velocity and their mechanics. And I understand working on mechanics. The kids need to take at least 3 or 4 months off totally from pitching. So that's an important part. The other part is in the kids that we have treated, number 6, the kids that we do treat, they return too quickly. They want to be off. They rest for a week or two. They're anxious to get back. Their team needs them so badly. A lot of teams don't develop enough pitchers, and they're rushed back into playing too soon, and these injuries are not healed yet. For many of these kids, it's 6 weeks off of throwing, and then they start a pitching progression program that's often 3 or 4 more weeks. and a lot of people just won't take that time. I know our seasons are short. There's a lot of anxiety to get kids back. So what ends up happening is these growth plates get injured. Sometimes they never really heal all the way. Sometimes, many times, we can never get them back to pitching, to throwing with enough velocity to be a pitcher. And what really surprised me maybe the most, I used to say that almost always kids before age 16, it would be a growth plate injury known as little league elbow to the elbow or little league shoulder to the shoulder, where they would damage or injure or stress fractures to these growth plates. But then we started to see UCL injuries, Tommy John type injuries at, 15, 14. We even see some 13-year-old kids now that are tearing the ligament in their elbow known as Tommy John surgery. And it's kind of a shame because many of these young kids at 12, 13, 14 never get the chance to even pitch in high school because by the time they get there, they have such chronic injuries to the shoulder and elbow. And so I'm going to make one final plea here today to look at those 7 prevention things that we just talked about, 7 prevention principles that they could use. If you have a good young pitcher, use those 7 prevention principles. If anybody has a question about that, they know where they could get in contact with us at the Sports Medicine Center at Akron Children's, and we have our prevention protocols for young throwers. But it's an area that we haven't made as much progress as I would have hoped early in my career, but I always still hold out some hope that we're going to get there, Ray. I know it's one that's near and dear to your heart, but it's something that we need to continue to work on.
Yeah, I agree, Joe. And often it's not just pitchers. With travel baseball now, pitchers and catchers and infielders, all that stuff, with the training that begins in November, goes through the high school season, high school and the travel ball into August, and it's almost 12 months a year. You're seeing so many of these injuries. Joe is spot on there with his diagnosis, as always. My friend, thank you for the company. We'll reconnect next Wednesday, Joe.
Thanks a lot, Ray. Enjoy this week.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital.